All right, 6:16 on News 3 this morning. Great weekend to celebrate Pride in the Peak. Take a look at what it looked like yesterday afternoon in the Summit Point development of Chesapeake yesterday afternoon. Third year in a row for this family-friendly Pride event in the city. I was honored to be able to say a few words on stage at the event. Wonderful crowd there. News 3, the proud sponsor of Pride in the Peak this year. And as we celebrate Pride Month in this country, I wanted to take a look at the issue of healthcare in the LGBTQ plus community, the challenges many face both physically and mentally, and the support coming from right here at home.
That's just not something that we should be seeing in 2024, but we were.
ODU nursing graduate student Dani McChesney was floored when she saw the numbers. The toll HIV and AIDS is still taking on our community.
We have the solutions, we have the technology. It's just being able to integrate those communities, to implement education, to implement these interventions that could help people save their lives.
Stats from the Department of Health and Human Services show Black men in the U.S. are 6 times as likely to die from HIV and AIDS than white men. McChesney saw this firsthand while leading Old Dominion University's student nursing group. Her team spent time in Portsmouth working with healthcare providers to get more people tested and teach them about prevention, like PrEP, a drug that can be used to help prevent HIV.
HIV in these communities is a public health crisis, and it requires a public health intervention.
McChesney believes earlier education for all could save lives.
What we should be looking at is the sex education that we have in our high schools and our school systems. Maybe we should look about broadening that to not just heterosexual education, but broaden it to everybody.
Media exposure helps too.
Starting today, the world will know me for who I am, not who you want me to be.
McChesney points to movies like 2023's Red, White, and Royal Blue, where characters discuss safer sex on screen. Experts know visibility, evolving attitudes are also key when talking about mental health. Liam Costello is a licensed clinical social worker at ODU.
More and more people are able to find accepting communities and to continue to feel loved and accepted by their families and friends.
You know, I can speak from personal experience. You may have those around you who are accepting, but unless you can accept yourself, that's where that starts, right?
Absolutely, right? That internalized shame, the idea that a lot of people, when they're younger, have the idea that because I'm different, there's something wrong with me. And I think that is something that a lot of us do have to work through as we get older.
Research from the American Psychiatric Association agrees finding members of the LGBTQ plus community are more than twice as likely than heterosexual people to experience a mental health condition in their lifetime.
Most members of traditionally or historically oppressed groups do experience higher levels of mental health because, right, you live in a world that tells you there's something wrong with who you are. And how could that not be damaging to ourselves and our psyches, right?
So how does that change? Costello says it's on all of us.
I think that when we are quick to stereotype and to put people in small boxes, then we miss out on kind of the complexity of the human experience.
Now, whether it's at ODU or from one of our many community groups, there are lots of resources for people here in Hampton Roads. I've put some links inside my story on WTKR.com for easy access. Also on that page, a link to the list of questions you should be asking your doctor.